before I do anything else, let's talk really quick Cushing disease versus Cushing syndrome. So Cushing syndrome occurs when you have an excess glucocorticoids. For any reason, it leads to symptoms from excess cortisol. Cushing disease is a specific type of Cushing syndrome in which you have pituitary tumor that is secreting ACTH in high amounts. Okay, now there are 4 large categories of things that cause excess cortisol. It's categorized by the anatomical location and whether or not it's dependent on ACTH. So I'll just write anatomy, the location, and ACTH dependence. So I can have a pituitary ACTH dependent adenoma, and that is just like it sounds. So you have your hypothalamus, and then here in your pituitary you have this tumor that is secreting ACTH. It will come down to the adrenal gland and cause production of cortisol, which will feed back and inhibit CRH. So you have really decreased amount of CRH, and the decreased CRH is not able to stop the ACTH because it's a ACTH producing tumor. So this is in the pituitary and it depends on ACTH. This would be considered Cushing disease. The next big category is the adrenal adenoma with ACTH independence. So again, this is just like what it sounds. You have your adrenal gland. It's going to produce a tumor that secretes glucocorticoids. The glucocorticoids are then going to go feed back onto the hypothalamus, causing downregulation of CRH. And the downregulation of CRH is going to hit the anterior pituitary and cause downregulation of ACTH. Then in the last two, so you can have ectopics. So ectopic ACTH or ectopic CRH. Now with ectopic ACTH, so you have your pituitary right here, and you have your hypothalamus, you have your pituitary, you have your adrenal gland, and then you have some extraneous source of ACTH. So this feeds over here and causes a high cortisol. Cortisol feeds back and inhibits the CRH, and due to that you get inhibited ACTH. And I actually drew this wrong. Whenever a decrease in CRH is inhibiting the ACTH, it really is supposed to be drawn like that on the graph. And so you get a decreased production of ACTH in the pituitary, but the circulating ACTH will still be high. Then with ectopic CRH, so you have your anterior pituitary, or you have your hypothalamus, your anterior pituitary, your adrenal gland, and you have your extraneous source of CRH. CRH is going to upregulate ACTH, and ACTH is going to upregulate cortisol, or I'll just say glucocorticoids. It's also going to upregulate the androgens. Don't forget, anytime you have ACTH, you're going to have increase in androgens as well. Whenever it's ACTH independent, you're only going to have increased glucocorticoids. The cortisol glucocorticoid is going to come back and inhibit CRH production, but you're still going to have high CRH because of the ectopic source. You're also going to have higher ACTH and higher cortisol than normal. Okay, now with Cushing disease, usually the symptoms are going to be slightly more mild, and it's got a great prognosis. With ectopic sources of corticotropes, you're typically going to have a poor prognosis, and because they tend to secrete ACTH in much higher amounts than you get from the pituitary, even in Cushing disease you don't get an extremely high amount of ACTH, but with these secreting tumors, a poor prognosis, they have higher amounts of ACTH secretion, and so you get more symptoms. You also have a lot of other comorbidities because these tumors tend to be in the thoracic region, primarily in the lungs. So we're just going to put here for you to remember lungs and poor prognosis, and then extremely high ACTH typically. So another thing to note is that whenever you have increased cortisol, it's going to be different in men than in women for the androgens. So increased cortisol goes back and suppresses LH, and without LH you get a decrease in testosterone. In women, on the other hand, this ACTH is stimulating androgens, and then those androgens can be converted in the periphery to testosterone. So they have increased androgens, increased testosterone, and so even though the same thing is going on in men, the amount of increased peripheral testosterone that they get pales in comparison to the amount of testosterone that they lose by not having the LH. So then if you look at increased testosterone, hirsutism, acne, virilization, and in men you get things like decreased libido and impotence. So with an adenoma, with an adrenal, so let's talk about adrenal tumors now. Adrenal tumor, you get an adenoma, it's going to be almost always only glucocorticoids. But if it is a carcinoma, you're also going to have androgens produced. And this is basically the exception to the rule that I just told you about ACTH independent tumors. Alright, the last thing that I need to say before I wrap this up is you can also get a Cushing syndrome from excess glucocorticoid therapy. So if you're undergoing immunosuppressant therapy or anything like that with glucocorticoids, then you can get Cushing syndrome as well. And the term for this is iatrogenic. And now it occurred to me right last minute, I mentioned earlier that I was going to explain that in some cases you're going to get mineralocorticoid problems with Cushing. And so I want to do that really quick. So the first possibility is that mineralocorticoid receptors, so I'm just going to put the M receptors, they have some affinity for cortisol. It's small, but it's got some affinity for it. However, the way your body protects itself from this activity is that it uses an enzyme 11-beta hydroxy steroid dehydrogenase. And that converts the active cortisol into cortisone. However, whenever your cortisol levels go up tremendously, it overcomes this enzyme. And so you're going to have cortisol that's going to make it to the mineralocorticoid receptors and activate them. However, that's not all. Also, like I said earlier, you have this carcinomas. Whenever you have an adrenal adenoma, you're only basically going to get glucocorticoids. However, when you have a carcinoma, of course you can get the glucocorticoids, you can get the androgens, you can also get, in some cases, the mineralocorticoids.